I'm now going to turn it over to Dr. Dennis Charney, who will introduce our keynote speaker. Dr. Charney is the Ann and Joel Aaroncroft Dean of the Icahn School of Medicine at Mount Sinai and President for Academic Affairs for Mount Sinai's Health System. Thank you.
Thank you, Bob. I want to acknowledge that Dr. Wright and his team in the Department of Environmental Medicine and Public Health and the Institute for Exosomic Research, as Bob has mentioned, they're engaged in critical research that literally impacts the entire planet as it relates to climate change and the growing threat to our health. The school, the Icahn School of Medicine at Mount Sinai, is proud that this institute is the first, or certainly among the first in the world, focusing on the emerging field of exosomics, which recognizes, as Bob illustrated, that environmental factors are interconnected with human health. So it's not just genes. The environment is really important. How we take care of ourselves, obviously critically important. We work together to understand the health effects of environmental exposures, including the effects of a warming planet. And we work to translate these findings into new strategies to prevent, predict, and treat human disease. Today is Mount Sinai's 4th annual climate change conference. And as we gather today, and we wish we were gathering face to face, the world is witnessing the fact that populations most vulnerable to climate change are suffering very high rates of respiratory, cardiovascular disease, kidney disease, insect-borne diseases, malnutrition, and many other problems. Climate change is having a major impact on the social determinants of health and consequently health equity. Perhaps more important than any other health outcome, climate change is having major effects on mental health. And I certainly realize that as a psychiatrist. So it is fitting today that the focus of today's conference is mental health and well-being for patients and clinicians and how that relates to climate change and environmental factors more generally. Climate distress is very real, and it is a troubling phenomenon, especially for young adults and teenagers. As young people learn about climate change, many worry about their future, and we worry about their future, and how damage to the environment, coastal communities, for example, will impact their health. Some worry that literally the world is on a path to self-destruction. For example, a recent survey of thousands of teenagers and young adults in 10 countries found the following: 58%, 59% were extremely or very worried about climate change. And over half felt sad, anxious, angry, powerless, etc., regarding the effects of climate change and doing something about it. 75% of these teenagers felt the future is frightening. How bad is that? 56% said humanity is doomed. So these are very troubling statistics. They should worry all of us. If young people are going to have the fortitude to deal with climate change, they're going to have to build their resilience and fight. Some of the ways they can build that resilience, those resilient skills, and this is an area that I have studied for about 30 years, and that is how to enable people to become resilient, to deal with obstacles in their life. They need to reframe stressful thoughts, develop coping skills, develop a strong moral compass, among other things. Rather than stressing over being a victim, they can be the change agents. They can take positive action as climate activists, and we need to help them do that. On a personal level, they can live an environmentally conscious life that reduces their personal carbon footprint, and that's a message to all of us. By building our resilient skill set, we can better manage the stresses of climate change, including the stress of learning about the subject, be frightened about what we're learning, and again, be change agents.